aims to vaccinate 70% of its population by the end of November amid the lingering vaccine hesitancy. This morning, they embarked on a mission to vaccinate taxi drivers, hawkers and commuters at the Cape Town station deck. This also comes just after the president's address to vaccinate the whole nation. Vanessa Poonah has more.
A COVID-19 vaccination outreach is taking place at the Cape Town taxi deck here this morning, where the health MEC, Mbombo, as well as transport colleague MEC Dalen Mitchell and representatives from the city of Cape Town have come out to create awareness about the COVID-19 jab. Now, at the taxi rank here this morning, I've spoken to quite a number of taxi drivers. Some of them, like Stanley Woodendal, a short while ago, telling me that he has received his jab, he has his card, and also that he would feel much safer if all commuters indeed are also vaccinated. In the province, just over 2.5 or 2.4 million vaccinations to date. Let me bring in Minister Mbombo right now. MEC, so today you have been speaking to the various role players here at the station deck, taxi drivers, commuters, hawkers at the moment as well. Now, we understand just last night the President announced a relaxation of restrictions, which means more economic activity. What does this mean then for the industry itself and the importance to get everybody using taxis, minibus taxis, to be vaccinated?
Yes, we're taking vaccines to the people, and we know that in this kind of an environment, that's where you get most of the gatherings. And coming to fourth wave in December, and that the president is opening up, it is going to be a challenge. We're not safe until most of us are vaccinated. So there is no way that you can expect a hawker to leave their goods and go to the clinic to vaccinate, because they need the money. Therefore, we bring the vaccinations to them. As they are hustling, hawking, they could be able to walk, because the clinic is just here at the taxi rank as a pop-up vaccination site. Similar with the taxis, we've been here since about 6:30 a.m. For them, others drop them, commuters off, others pick them up. Now, as you can see now, they are relaxing, they've parked the cars, so it's the time for them to walk across to get the vaccination, because that's how things should be. As we indicated when we were even doing the jabs before Joel, where we take the vaccinations to the clubs, taking vaccinations to the churches before Holy Joel, just like as we did with the homeless, where we took them to where the homeless are. So it's similar here at the taxi rank. We'll be going to the other taxi rank. We have already had a conversation with the taxi association in regard to going to where it's busy, like the Belleville and all of those. There's no other way around.
Minister, I know that you've been working hard, you've been traversing the Western Cape, you've been out there getting the message of vaccinations with events like this, pop-up events, as well as taking it to the various communities. There have still traditionally, and especially in the metro, been some areas with traditional, if I can call it that, vaccine hesitancy. Have you seen an increase in uptake in the areas, and I'm talking specifically like areas in Khayelitsha, areas in Mitchell's Plain, for example. Have you seen a difference over the past couple of weeks?
There's been improvement. In Khayelitsha, for example, when we even took the vaccines to the Rans Club, we've seen quite a higher level of intake among the young people, AMA Bundles, the AMA TikTok group, but also the city of Cape Town has assisted to have some pop-up vans in some of the areas. In the Mitchell's Plain, especially during the time of the SASA, we did have some pop-ups to attract more of the over 60-year-olds. And also working with the religious leaders to be able to vaccinate as more. So there's been some improvement. But outside the metro, in the conservative colored communities in the remote areas, like 2 days ago, I was in Matikama, in Vredendal, and there are some areas where the Tani say that in Nochni, they don't want to be vaccinated because they come up with compelling reasons where they say that I've never been ill, I don't have any comorbidities, I am 75, why should I be vaccinated? Therefore, that's when you have to provide more information. For them, it's about the illiteracy related to the health information about the vaccines. So when we explain to them about the issues of the mutation and also about the fourth wave, and that they might not have a beautiful Christmas festive season which they long for, because last year everything was doomed. You'll find that they are warming up. Similar in Central Karoo 2 weeks ago when I was there, which is like areas Leochamka. They highlight the spiritual for reasons for not vaccinating, but we left them with a message that is clear, because as I indicated earlier, some of them, it's not necessary that they are uninformed, but they've been misinformed because of the influencers of the community leaders in those areas. Yeah.
Minister, I spoke to a MACO member just now, Councillor Zaid Badruddin, and he was telling us that from the city of Cape Town, they are seeking legal opinion in terms of over this coming season, as we go into the season, whether or not the city can, for example, say that only vaccinated individuals will be able to access things like the municipal swimming pools, etc. Is this a discussion that you're having at a provincial level as well?
Generally, from the human rights perspective, we as health, we cannot be able to mandate people to be vaccinated in order to access services. Just like, for example, when we talk about the issues of the alcohol and impact on trauma, we cannot say at our emergency center we're only going to prioritize people who didn't drink alcohol. Just making an example. Because even when you triage, the criminal who is priority one might end up being the one who's being first seen compared to a child or some adult who actually is not even a criminal, because that's the nature of health. So similar, you cannot say no, people cannot access social grants or they cannot go to the hospital unless they are vaccinated. You can't. However, other sectors can be able to say, you can't come to our clubs until you are vaccinated. You can't come to a sports function before you're vaccinated. As we have seen, for example, in the traveling, you cannot travel until you are vaccinated. As we have seen in the education sector for the children, where they say that your child, before you enter grade R or grade 1, needs to show a road health card that they are vaccinated. So it doesn't stop other sectors to provide mandatory vaccination. But from us, it's about to provide information so that they can make informed decisions. Just like in the club, they say that you can't go inside without wearing techies. They could be able to say so that you can't go inside, but as health, you cannot be able to deny people to access things that they have got a human right to access.
Minister Noma Mbombo, of course, the MEC for Health here in the Western Cape, and a team out here at the Cape Town taxi deck this morning, bringing the message of vaccinations and also urging those that are keen, whether they are hawkers that apply their trade here at the taxi deck, or whether indeed they are drivers or commuters, urging them to make use of pop-up vaccination sites, which will be taking place here at the station itself, but also then to encourage those that may find themselves still at this stage vaccine hesitant to get the information, and also then to refer them to the various other clinics just around the corner. Of course, the Cape Town International Convention Centre is a mass vaccination site, and of course we also understand that other sites, for example at the City Council, also people will be taken and informed where they can access the nearest site. But of course, speaking to those taxi drivers, those I've spoken to have said to us that they do believe that they would feel much more comfortable if indeed all taxi drivers and commuters themselves are vaccinated, because as one of them, Mr. Stanley Odendaal, told me, he's lost quite a number of people during the first to third waves and would not like to see a repeat of that taking place come the inevitable fourth wave of COVID-19.